Hi there, everyone. My name's Amanda from LTR Medical. Thanks for joining me today to learn more about the Accufuser. So the Accufuser is an elastomeric device. So that means that it's driven by the power of the balloon inside it. Um, Often elastomeric devices come as a whole kit form. That means they include carry bags, introducers, tunnelers, catheters, etc. The Accufuser is quite different. It comes as a single unit and then you add on all of the extra components you need. I'm just about to hold up what it looks like in the package. So as you can see in there, all we have is one device. It does certainly say on the label the style and the size of the device and the range of mils per hour that it does. I'm actually going to train you today on the 600 ml device. It has a flow rate of 1 to 15 mils an hour. So as you can see, it's called the Accufuser. This is the carry bag, which is also purchased separately. So from your supply room, make sure you grab the device as well as a carry bag. And now I'll show you how to fill the device. As you can see, this is a large device. This is the largest one we have in our range. The smallest one is 60 mils and this is 600 mils. If you've previously been working with a soft casing, for example, something like a non-Q pain buster, a couple of things that you'll notice different to this is due to the hard outer shell, it actually makes filling of the device much easier than you may previously experienced. I've had many a scrub nurse tell me how easy these are to fill. The other thing that you will notice is on the ward, you can actually see that the volume is infusing. How do you know that? And that's because there's a range here on the side. So as we do fill this device, you will see the balloon inflate with fluid, but ward nurses can certainly see how much is remaining in the device. This one has a filling port here. This has a one-way valve only, so you cannot withdraw fluid from here. Then we travel along the line. There is a blue clamp on the line. You don't actually need to use this at all. And then this is our flow selector, followed by the air elimination and antibacterial filter. You will notice on the flow selector, it goes from 1 to 15 mils an hour, and there is an arrow here. So you need to line up the number that you are running at. For example, if it's 5 mils an hour, you would line that up to the number 5. Now I will show you how to fill the device. I am using a large 50 ml syringe. This also does not come in the kit, so please make sure that you grab one prior to your case. I will now just open. You would use a sterile technique or aseptic non-touch technique. This is a Lure lock connection. You will see as I'm connecting this device, you will see the balloon inflating. I am able to depress this with just my thumb on the syringe, which is quite different to some of the other devices out there on the market. And as I said, this device takes 600 mils. I'll just put another one in so that you can see the balloon inflate slightly more, and then we will continue with the rest of the education. If you are evaluating these in any hospital, you would have my direct contact details. I'm still currently registered, so you can call me at any time. It doesn't matter day or night. I will answer my mobile if you need some troubleshooting advice. Now, this is a 600 ml device. With all of the devices, you need to fill them to at least 50% capacity to get accuracy with the flow rate. So what that means, in a 600 ml device, you would need to put at least 300 mils in, but you do not need to completely fill them. I know some other devices you need to completely fill to remain accuracy. That is not the case with this one. There is only one specific instruction to take note of with these devices, and that is during the filling process, you will notice that fluid extends up the line into the balloon, but it also extends down towards the distal end. And on this filter, there is an arrow. So please position this filter on your sterile field or on your clinical field so that the arrow is pointing upwards, so that we don't get any air trapped in the filter. It does its job the way it's meant to do it. At the end of the line here, you'll also notice that there is a blue cap. This allows air to escape, but not fluid. So you keep this cap on throughout the whole priming process until it is time to connect to the patient. Now, for example, let's imagine that we've been given our prescription and we're going to run this device at 10 mils an hour. This is one other benefit over some other elastomeric devices. The one device can be used for multiple procedures. For example, only a shoulder surgery may run at 2 mils an hour. A large laparotomy may run at 10 mils an hour. As I said, just for an example, but therefore you would only need to carry one size on your shelf. So I have now lined that up so that you can see that is lined up to say 10 mils an hour, and then the key is removed. Now that key needs to remain or end up with the nurses on the ward. It is not to be left with the patient at all. Then upon priming of this device, you will then open the cap, and when you see your first drop of fluid, which I'm seeing now, you are fine to connect it to your catheter. So that's for theatre staff. Obviously for PACU or recovery staff, what you'll be doing is you'll be checking the label on the device. It will come with its regional label, because these, in this instance at your facility, are being used for local anaesthetic. So you will check that it's got all of the appropriate patient details on here. You will then make sure that the prescription is accurate. If your prescription says 10 mils an hour, make sure that in effect it is running at 10 mils an hour. And you will be able to record the volume remaining in the device. What you'll see following this clip is now one of the catheters that you're also currently looking at is the Eldor, which is a blunt trocar. It's a large wound catheter with 10 centimeters of fenestrations. And when you're connecting the end of that, you need to place the luer connection on. I will follow this with a short video to show you how that's done. Thank you for your time.
Okay, so get this green and white adapter, loosen it in the middle. You can take it right apart, but you don't need to. So just loosen it in the middle. Then you insert the catheter end as far as you can, and then tighten it, and that will hold the catheter in place.